work and project management. Then we have foreseen some research on the principles of development effectiveness across the region, and this is part of the in the next 2 years. And then with the aim to improve the civil society capacities to effectiveness, we have foreseen research on enabling environment for civil society organizations to be able to contribute to these processes, and another area of work, which is private sector engagement. So this has been something CPDE has been working on in the past period, and identifying that there is a huge need for engaging with the private sector in promoting effective condition for effective development cooperation, which is the enabling environment for civil society organizations. So there will be a stream of work targeted towards this. So I'm sharing this just so you keep in mind that this is something that is coming up. Then hopefully, if the COVID-19 crisis ever goes away, which we really hope it does, there is a mobility fund plan for from next year and the year after that, which is aimed to support constituency participation and advocacy activities and relevant European and global events. This will be done through an open call, and it will be an ongoing open call through which we can support individual efforts of organizations and promote their more active engagement in these types of activities. And the last thing, civil society private sector engagement for promoting development partnerships, and this is an area which we want to sort of open the space for better engagement of the civil society organizations. This is just in brief, but of course more information will follow and will be forwarded to you once we are having the more concrete activities and opportunities for your engagement. So now I would give the floor for the presentations for the case studies research. We can go first with the presentation for alphabetical order, giving the floor first to our member organization from Albania, which is Partners Albania. And here with us we have Clotilda Tavani Costa and Nina Keruti. So they will be both having the presentations, and they will be both taking the presentation.
Thank you, Biljana, for the presentation and for this initiative and giving us the opportunity to be part of it and to prepare the case study for Albania. Shortly, I will summarize the main points of some of the evidence that we have gathered during this time for the purpose more detailed presentation of the study. Of course, Albania, like many countries in the world, is facing with the crisis caused by the pandemic situation of COVID-19, with the first cases identified in February this year, and then immediately followed by the measures and the action plan prepared by the government. We are still in this crisis, and as you, Biljana, said, hopefully it will end soon. So therefore, some of the measures, restrictions taken by the government are still in place. I have to say that with regards to these measures, they have been taken, drafted, prepared government with no consultation with other stakeholders, including here the civil society organizations. which I have to say have been very active in this period, and have, despite facing a lot of challenges in order to continue with their activities and to respond to the needs of their beneficiaries, CSOs have been, as I said, how to adapt to this situation in order for them to continue with the activities and services delivered, offered to their beneficiaries. And despite that, unfortunately, we have to say that no support has been provided by the government to civil society organizations like the other sectors in the have also been very active in responding to the needs of civil society organization and providing them with facilities on how they can continue with their work. Now I will give the floor to Nina to share with you the PowerPoint presentation that we have prepared with the main data and findings that during this period, and then we are open for questions if you might have. Thank you again.
Can you hear me? Okay, perfectly. Okay, I'm taking this opportunity to say this global meeting means. So it's a very pleasure for me to present the Albanian case, as Claudia did a general view, but I will go more in depth and present to you the situation and how the Albanian has and is responding towards COVID-19. But before I start my presentation, I would like to give some facts about Albania. So Albania is a small country located in Balkan Peninsula with a population nearby millions, and the population density is about 105 per kilometer square. Most of the population lives in urban areas, such as 63.5%. And if you have heard that Albania years ago was a young population, now is becoming an aging country with medium age about 36.4 years. And I would like to about coronavirus crisis, and these are data, yesterday data as per 30th September. So the total number of tests that currently is done by our health institution is 88,000 tests, out of which 13,649 cases are positive with coronavirus, are declared positives. 40% of these cases are active cases, so 387 people have lost their lives during this coronavirus. But what was the impact on social economy through this virus? As Lodi mentioned, the first cases with coronavirus two cases were announced on 8th March 2020, and since then, in line with the action plan for prevention, preparation, and response towards COVID-19 scenarios, and according to the 4th March declaring the natural disaster situation, the Albanian government and the Albanian country went to a lockdown and quarantine when preventive and precautionary measures took place, such as closure of educations, banning of public gathering, and banning of public activities. And we faced weekday curfew hours and weekend lockdown measures which were imposed in order to minimize and restrict Mindful, and what we have evidence is that during this kind of period from March up to now, because still there are legal acts that are in place. In total, there are 211 legal acts on COVID-19, which has been approved and are easily accessible through the official Gazette websites, so everybody can find information on what are the legal acts that were enacted during this period. But what were the impact that COVID-19 has on social economic aspect? The first, as in many countries, the lockdown and quarantine measures decreased the amounts. As you can see, the data here are for the first quarter, so the GDP decreased by 2.52, and the main branches of the economy also faced decrease, with leading by construction industry, 7.80%, and transportation accommodation with 3.65%. So the export and import decreased by 6.24%, and during the first period, as per April 2020, the tax revenues have already declined by 12.2%. The sector which was much more impacted was the tourism sectors. Tourism is one of the most important sector for the economy of Albania. If we can bear in mind that our economy were in crisis due to earthquake that happened on November 2019, and because of this pandemic crisis, the number of visitors and tourism sector was the most affected. The foreign visitors declined by 60%. We do have a special attention to the small and medium enterprises, which were hugely affected. Reduction in capacity utilization, supply of labor, and liquidity shortage, which was three of the main aspects that we evidence for the small and medium enterprises. The impact of people, as I already mentioned, so we have 13,000 positive cases, and unfortunately 387 deaths. 50,000 people have lost their job, and according to the National Bank of Albania, around 100,000 jobs are at risk. So the unemployment rate will be increased with 7.4%. The women and girls are much more affected rather than men, because many women in Albania are employed and are still disrupted due to COVID-19 quarantine measures. As some of the states face, even in Albania, during the quarantine, the domestic violence for women and girls increased almost 3 times, based on the evidence and the research to date that many organizations has done with this proposal. Shifted from on-site to online, around 11,000 students, mainly having access to online learning, and because of the lack of access to internet or digital devices at home, being mostly in poor areas. In order to somehow to endure this kind of situation, the government of Albania approved 3 financial packages with a combined size of US dollars. The first financial package saw sovereign guarantee up to approximately 100 million US dollars for companies that met difficulties in paying salaries, so in order to help the economic sector, but also it foresaw approximately 65 million US dollars for most immediate needs for the neediest layers of the population. So economic schemes or at the unemployment schemes. And were unemployed because of the COVID-19. The second package, financial package, saw a sovereign guarantee up to 150 million US dollars as a new financial instrument intended for tourism. As I mentioned, tourism was one of the main sectors that COVID-19 impacted. Manufacturing businesses and fashion industry. So it provided financial support to current and laid off employees as a result of COVID-19, the so-called war wages. So for people that were unemployment. And the third package was addressed to public transport sectors. It was the last sector that was open after the quarantine measures, mainly covering the wages of employees. You can have, unfortunately, these data are from Ministry of Finance and Economy. So these are disbursement for the first package, and from the second package, the data are in Albanian, but we have prescribed them. And we have data from payment of wages. So the yellow line, as you can see, was what the government anticipated to pay, but due to the COVID-19, the beneficiaries were increased in numbers. So partnership in COVID-19 response, we have in place two strategic documents: the Action Plan for Prevention, Preparation and Response against COVID-19, which was initially that the two cases were announced, and the reopening strategy, which is currently the strategy that is implementing the Albanian government in order to foresee three scenarios that anticipate if the number of COVID cases will be higher, then the country will also go into lockdown. As Claudia mentioned, no consultation was organized on both strategies, and as a result, no cases of strategies proposed raised by CSOs are actually reflected in policies and strategies related with COVID-19. With regard to multi-stakeholders bodies, there are two important structures in place to of infection spread by the new coronavirus. So it's a task force composed by 10 people, 8 from the health representative from health institutions, 1 representative from WHO organization seated here in Albania, and 1 representative is from the state police, mainly in charge in borders. State police, and we had an ad hoc committee for the spread members, all coming from health institutions. So no participation from the parliament, from civil society, from private sector in this structure that are established to respond to COVID-19. So what we have evidence through this monitoring exercise is that there is no system in place that would align coordination aid in response to COVID-19, and the data present in order to have the general pictures of donations. And no information is available on predictability of COVID-19 financing, and the aid of what was we saw that is that the aid from donors is forecasted both even on short-term but even on multi-year basis. So both approaches are followed by donors. In this table, as you can see, our data have another data, but up to now the European Union has allocated 15 million euro to respond to economic situations, and on September 2020 180 million euro will be allocated, but will be delivered in form of loans. The US government through SITE has allocated 2.4 million International Monetary Fund $119.5 million as a rapid response that the government has to COVID-19, and the World Bank allocated up to now 15 million euro to respond to the social economic. But we have also found that various bilateral donors, including China, Turkey, Germany, and other countries, have provided diagnosis to help the health institutions and hospitals in order to better respond. As we have mentioned, no participation of stakeholders in the design, implementation, and monitoring of the both strategies. Both strategies were designed and implemented by the Ministry of Health and Social Protection in partnership with the Health Institute. Even though the legal framework enables citizens and relevant government information through the request, in practice, many CSOs, many citizens face difficulties, and the concerns here are raised mainly from media and journalists, because for them it were impossible to obtain independent information. All the information is provided by higher officials in the ministerial levels and not by technical officials. So they have this kind of limitation in the verification of press releases and is faced. Also, the legal framework does not present any barrier to CSOs that work with marginalized population or at groups that are at risk, as they are obliged to follow the state protocols measures of COVID-19. But in practice, when we did the discussion with CSOs, most of them had challenges to provide direct services for this group to these restriction measures. And if we talk about human rights, which are very crucial, and we have faced many limitations of human rights as in every country, but in Albania imposing high fines with a lack of analysis, and we will see an example advocacy, what did civil society organization, almost human rights organization, to advocate to and currently we still have into force banning the public gathering in the assembly. So up to the moment we cannot participate and we cannot organize a free assembly, because on 1st of April the Albanian government presented a note to the Council of Europe to derogate from the Article 15 of the European Convention of Human Rights as, due to these restriction measures. Even though we have evidenced the public gatherings, up to now, many assemblies were organized, but 9 of them were dispersed by state police and 119 individuals were prosecuted. So facing this kind of reality when human rights are in Albania, the Albanian Ombudsman released a letter with recommendation in August to the Ministry of Health and Social Protection, to the Prosecution Office of Albania, and to the State Police, even to the task force, because all these measures are currently in place because the task force established to respond to COVID-19 give this kind of recommendation to the Albanian government. So the Ombudsman asked to ban this up to now practice by the state police in order to facilitate and to respect the right to free assembly and public gathering. So it was one letter issued, and it was very much appreciated, because it gives much more space to civil rights and civil participation. And when we talk about how CSOs responded to COVID-19, we'll have 3 good practices. The first one is in April 2020, the Partners Albania, the National Research Center for Civil Society in Albania, provide a support package. It was called a rapid support for the sector, which included two main pillars. The first one is 1 year access on the Zoom platform, the costs of which are covered by Partners Albania and the National Resource Center for Civil Society. And the second one, providing online training for the use of series of online platform, because shifting from on-site to online and having in mind that on March and April, there were mainly so many online platforms. We wanted to give the CSO opportunity to choose the right tools and platforms available. With regard to advocacy, as I mentioned earlier, we talked about the restricting measure, and on April 2020, the government proposed amendments to the criminal code, which foresaw fines and prison sentences up to 15 years for those that violated quarantine. So it was a harsh penalties for people. And a group of 32 civil society organizations, bearing in mind that no consultation took place to this kind of amendments, they issued a statement and demanding for Parliament not to approve the draft law that the government presented, because the proposed amendments were not in line with the Albanian constitutions, and imposed high sentences with a lack of analysis. The decisions were very rapid. So through this statement, what was achieved is that the Parliament approved the criminal code, but not as the initial draft, not as proposed by the government, but mitigating the sentences to maximum at 8 years of imprisonment and removing the double charges and only imposing a fine for asymptomatic patients that had. So what did CSOs leveraging about the EDCs? We are presenting an example from a youth organizations. So shifting, as I mentioned, shifting from on-site to online and giving the opportunity mostly to the youngest. We have 4 campaigns here. The Good from Home, which was an activity. The organization is called the Pokaere and is located in a center of Albania here. The activity included the use of digital tools to empower young people and send positive messages to the local community. So they did online debate club by using this opportunity for young people to start conversation on different topics, online conversation on different topics. Online training, they provided online academy of SDGs for 25 students, and also bearing in mind that they are young, they use World Community Campaign with photos and videos from youngsters in order to give this kind of positive messages even with this restriction in place. So this is the short panorama what have happened, and as Claudia mentioned, we are happy to respond at any question or need for more information if you have. Thank you.
Thank you so much, Nina and Claudia. This has been such an informative and beautiful presentation, and thanks for ending with a positive note. It looks like the world is changing, not to a better, but it's important to emphasize the role civil society organizations play in responding to the crisis. So anybody has any questions related to the presentations, or some clarifications or comments maybe for the presentation for Albania?
If I may, Biljana, I thought that both presentations will be done, and then we will be having an opportunity to ask questions. So I am lost in figures. That's why I would like to ask Nina you to clarify how much does it make the government support relative to GDP or public budget, and what you mentioned, it is likely that it is just 45 million USD, while when you showed the assistance of international organizations, donors, loan providers, including IMF, World Bank, etc., it is much more. So, for example, IMF support, is that a loan or is that a support or grant, whatever? If you could just show the sizes or relationship with major figures. This is my one question. And then you talked about the marginalized society. I guess, as in many other countries, how they were identified and which kind of support was provided to them by civil society organizations, if any action was made. And finally, the third question, how the infected people were detected. Did the government take any measures to identify them, to invite for testing? Was this testing for free or people had to pay? You talked about the fines that were introduced. Could you please also mention the size of that in US dollars to compare with other countries? Otherwise, thank you very much. That was an excellent overview, all-inclusive, comprehensive. Thank you.
I'm sorry, me and Claudia are in the same room, and because of the echo, we switch on, off. So first of all, thank you for the questions. I'm more than happy to respond. Regarding to the first question, the data are official data from the government. So the 45 million US dollar is what the government declared, and we saw the evidences on the Ministry of Finance and Economies. This is the one ministry which is in charge to manage all this kind of donations. You are correct when you say, but it's one thing to play it and the other thing that, to accomplish that place. So as I mentioned, one of the missing aspects that we do not have a system in place that align this kind of coordination. So donors say one thing, the government says one thing, so the predictability of funds is not public available, and we don't know how the money of donors are in this state budget as they declared. So it's very hard to find this kind of correlation between donations and the budget of the state budget. So we presented here the data that are official from the state budget, but we know that I think in Western Balkan, but in all the region, the lack of data is one of the currency, is one of the weakest aspects that the countries has. With regard to the second question, you are correct. The marginalized groups are the most affected as in any country. And we support the organization provided, as I mentioned, try to provide direct supports, mainly for those who need daily service, social services. So using this kind of mask and collaborating with local government in order to for those who came from rural or have difficulty in terms of economy, they wanted to point where are these kind of family and where the donation from the government would go. And with regard to infected people, so initially the public institute was the main public when all this kind of tests were conducted. So it was the main public institute, public health, which did all this kind of tests. Bearing in mind that there were criticism from the population because the number of cases might be much higher than the government declares. So in August, as I recall, they permitted some private health institution in order to provide this kind of test. in private institutions, health institution does not give free the test, so you should pay to do this kind of test. So this is much or less what in response to your question. I don't know if Claudia might have something.
Thank you, Nina.
Hi, do you hear me? Yeah. No, I think Nina responded to the questions. Just wanted to add something. First, about the fines that you mentioned. Actually, one of the concerns and opposition made to the decisions of the Council of Ministers was also related with the amount of the fines that were also considered as high. For example, the amount of fine for people infected that break, let's say, the quarantine was about, I don't know, in euro, around 800 euros. And for businesses that were not respecting this kind of measures were higher. It was around 1,000, let's say, euros. Yeah, around like that. While when it comes to the so Nina mentioned we haven't done this kind of analysis on what is the amount and how it is related with the GDP and the overall budget, but from the debates and mostly from the discussions of the private sector, which was mostly affected, and towards to whom these financial packages were addressed, it was not considered. It was considered low support by the government. While when it comes to marginalized groups, I can say that the organizations that have been mostly active have been the ones working with the people with disabilities. They have adapted that kind of their services through online counseling for parents, for example, of children with disabilities, and finding alternative ways to continue offering the therapies or other kind of treatment that these people and children with disabilities were in need during this period when they had no access to go to the organization or the staff of this organization to go to the houses to provide this kind of services. These are some. I don't know if we missed something, please.
We can come back later as well. The idea was to have the Q&As at the end, but given the peculiarities and the details, I thought that it might be a better idea if we have the questions and answers straight after the presentation. So thank you to the three of you for the lively discussion. Now let's give the floor to Arpi Grigorian for a presentation of the case study on Armenia. I think it will be very interesting to have a comparison maybe, or some reflections done afterwards as well. So Arpi, the floor is yours.
Hello, everyone. Thank you, CPDE, for the continuous cooperation over the year. Let me open the slides. Okay, everyone can see the presentation, right? Yes, okay. Let's start with the government measures to contain the spread of the virus. So a state of emergency was declared on March 14, and this included closing land and air borders, public transportation stopped working, also all academic institutions, both schools and universities, moved to an online format. And there were also restrictions on social media and press. On March 24, the restriction on movement was tightened. This means people who had a registration of their address could not move from region to region or from municipality to municipality. Public transportation, shopping centers, gyms, preschools, they resumed. But wearing a mask was made mandatory in all public areas. The state of emergency was extended 5 more times until September 11, and then it was replaced by quarantine until January 2021. However, there were some easing of restrictions, including air borders were open, and school classes and most university classes, they began operating in an offline format. By September 21, we had 47,000 number of infected. You can see that there were 265,000 tests conducted, and currently we have active cases of about 3,600. You can also see here in the chart percentage of dead and dead of unrelated causes. Okay. About jobs and income losses, in April there was a 7% decrease of number of registered employees compared to March. And you can see the number again rose in May, but also in April there was a 12% decrease in people who paid taxes compared to March. There were 22 actions, both economic actions and social actions, to respond to the consequences of COVID-19. 9 of them were economic actions, and these included support for businesses and the job support through loans and grants. Also, this included support for agriculture, microenterprises, the IT industry. Also, there were 13 social actions, and these included vulnerable groups, insecure groups, people who had become unemployed due to the pandemic, people with children under 13, also employees of the worst hit sectors, such as tourism, hotel industry, preschool staff. They were allocated minimum salaries. Ownership of the COVID-19 response. So mostly the response strategy of Armenia was developed by the government itself. However, it was backed by international donors, international organizations, and also Armenian diaspora organizations and platforms. The UN agencies came up with short, medium, and long-term plans, and also were heavily involved in public awareness campaigns. Many of them were included in the Commandant's Office's communication task force. And also there was a movement among Armenian diaspora organizations worldwide to both collect funds to fundraise and also to send direct aid, including medical kits and masks and other things. Among them, the biggest is the Armenian General Benevolent Union. Armenian churches were also included, and also the All Armenian Fund is the central body coordinating fundraising worldwide. About inclusive partnerships, I can't say much about government involvement of local CSOs. So NGOs mostly self-mobilized. Among their activities were, of course, information campaigns, awareness raising campaigns. Also, they had programs neutralizing the economic consequences of the virus. They provided direct financial aid and again, medical kits and other necessary items to target groups. And these included national minorities, migrants, youth, elderly, women, low-income groups, so all the risk groups. There was a lack of proactivity by the government, in including NGOs both in the design of the strategy and implementation of them. So this included also policies that they developed concerning freedom of education and freedom of healthcare. However, a lot of the interviewed NGOs reported donor flexibility in this matter, including prioritization of issues and redirection of funds to what the NGOs found necessary. Transparency and access to information. So a COVID-19 coverage was done on a daily basis. The government reported the number of infected people, number of tests, deaths, and deaths from other illnesses on a daily basis. And the government dissemination of this information was done via the Armenian Unified Info Center. Sorry, a little bit about freedoms. So freedom of expression. On March 15, mass media was required to disseminate COVID-19 related information only from official sources. However, on March 19, this decision was amended, and now it became possible for the media to share information from other official sources as well. So other sources from different countries or from international organizations. On March 20, a number of Armenian organizations, they disseminated a statement calling emergency provisions regulating media activities inefficient and disproportionate, which led to the easing of these restrictions. And on April 13, these provisions were made void. Freedom of assembly, we also had issues here. The state of emergency prohibited the organization and participation in public gatherings of strikes. And this was kept in place in the following 4 extensions of the state of emergency. However, on August 12th, this ban was also lifted, and the only restriction now is that participants of strikes have to keep the minimum 1.5 meter distance, and also wearing of masks is still mandatory in open spaces. And last slide, I think, right to privacy. On March 31, government could access, it was decided that the government could access data from mobile phones in order to stem the spread of the coronavirus. This was done to track movements of individuals done through phone calls and text messages. So they were able to track if there is an infected person, who this person had been in contact with through text messages and phone calls, and they would then track whether following these phone calls and text messages there had been contact between these 2 people. But of course, this was responded by a very strong reaction from CSOs and opposition parties. But unfortunately, this restriction still stands. And that is the end of my presentation. Thank you very much.
Thank you, Arpi, very much for the very informative presentation. Challenging times indeed. Any questions for this presentation or comments you may have? Yes, Alexandra, please.
If I can. Thank you so much, Arpi, but also thank you, Clotilda and Nina, for your insightful presentations. We at FON, through the Black Sea NGO Forum, have also been monitoring the impact of COVID-19 on civil society organizations as well. And we have been monitoring it up until the summer, but we can still see that some of the issues which we raised are still echoing up until today. I have a question more related to the civil society response. If you have any best examples of lessons learned in what regards civil society mobilization or getting together. COVID-19 indeed is a challenging context for all of us, but I think it's a great opportunity for solidarity in what regards civil society organizations at the national level. Thank you.
Thank you for the question. Yes, there has in fact been a very visible consolidation of CSO efforts, and actually this was revealed in interviews that I did with the CSOs. They all report communication between them so that they would avoid a duplication of projects and programs when cooperating with donor organizations. And also the target groups, the risk groups that I mentioned, also it was reported that many of the CSOs, they would gather around the target group, the groups that they were targeting, and try to bring together their efforts to have a more unified approach. And also, we could see a rise in mobilization in terms of responding to the needs of minority groups, national minority groups, I mean. Also, I forgot to mention that domestic abuse was also made very visible during these times. A lot of women's organizations also consolidated around this issue and talked broadly about this. What else can I say? Youth organizations also involved a lot of volunteers to go into regions that where people had less access both to information and to medicine, and in this way volunteers participated directly in information dissemination and also a little bit of information about how to take care of yourself and protect yourself from COVID. Yes. Oh, also I can say that there was also outside of CSOs a more civilian response to reaching elderly people who lived alone. There was also a movement to deliver food and to deliver medication to elderly people that did not have a kind of a support group. Also that.
Okay, Alexandra, just to respond to your question, I mentioned some of the cases. I mentioned that the National Resource Center and Partners Albania are providing for 47 civil society organizations free of charge Zoom webinars for 1 year. So even though they didn't plan before the COVID this kind of invoices in their budget, we provide them free of charge in order to enable them to keep in touch with their beneficiaries. I mentioned the youth organizations engaging youth even these kind of difficult periods. Also, there is a movement from diaspora, so the Albanian living abroad are making pot of money to deliver in rural areas, mostly in remote areas, in order to provide the basic needs of food, health. So it was very much even diaspora engaged as part even from earthquake that happened on November 2019. There are many cases which, as I mentioned, some guided the local governance when the humanitarian aid should go in order to have all the possibilities to have these basic needs. Also, we have a Helsinki committee which is providing free of charge services for prisoners. So even in this kind of difficult situation, there are always providing supports for immigrants and sentenced persons. So Claudia mentioned that the organization which provides direct services, not only with people with special needs, but even the organization that targets women and girls as part of their core work, they are providing services in order to endure and to even to, I mentioned, the domestic violence is one of the issues that we tracked, and they are providing free services and encouraging women and girls who are internally abused within their home to raise their voice in order to how can I say, to find the support for them in this kind of difficult situation. So yes, this is much or less, I hope.
Thanks so much for the responses and Alexandra's question as well. I also thought of sharing, like one example, we were, as a regional network, we were also collecting our members' contributions on civil society responses and on the situation. And there are two things that strike me the most. First one is that civil society has really promptly reacted in responding to the needs of constituencies, but it is still not well aware and known among the wider population. So it seems there are need for civil society organizations to communicate better the great work they're doing. And this goes into the relevance as well, but also in their visibility, and especially important for promoting the civic space and the value for civil society. And the other thing is the threats and challenges regarding the freedom of information against the fight against fake news. So also in the Balkans, what I saw, for example, for the Armenia case about the ban on unauthorized information sharing, this has happened, for example, in Bosnia and in Serbia as well, in Bosnia and Herzegovina and in Serbia. And it seems like an emerging trend and something that we should have always in the back of our mind, that the fight for fake news is real on one hand, but on the other hand, the threats to the freedom of expression. So it will be an issue that, like in our work, we should take it seriously, I think. So this is just a point for discussion, maybe for our next webinar. And I want to just thank you all, how beautiful this has been, like, and valuable this exchange, and for the great work you have done. And also thank the CPDE and the Global Secretariat for coordinating this. So please do share if you have any final notes or remarks or any questions in addition before we close the conference. We will share the PowerPoint presentations, and they're already sent to the Global Secretariat as well to be part of the global collection. And if there are no other comments, please, Justin, yes.
Yeah, well, I just wanted to say how much I was impressed by the quality of the work and the presentations. And if the other ones going on around the different regions are up to this standard, we'll have a very powerful message to tell when we have our global conference in November, where we'll be inviting many stakeholders to that. So congratulations to all concerned, and thanks a million for inviting me to participate.
Thank you for being here. Thanks to all. So looking forward to seeing you, preferably in person, but even like this, to the next occasion. Thank you. Bye.
Thank you.
Thank you. Goodbye.
And bye.
Bye.
Goodbye, everyone. Thank you.
Forgot the photo. It's gone.
We're still here.
Can we do maybe now just a brief of screenshot, maybe, as well, still they're here.
We did it. We did it.
Okay, thank you. Bye.
Goodbye.